Hello everyone. Welcome back to another episode of the project tutorial for foreign students here in University of Economics in Katowice. I'm Kostas, I'm Greek, and today we have a really unique guest, I would say, my good friend Anja. Anja, thank you so much for being here and finding the time to be here.
Hi. Hello.
So, could you please tell us a little bit about yourself? Who are you, Anja?
I'm Anja. I'm from Russia. I came here to study. I study for master degree. My program is international business, and I'm studying here in Economic University in Katowice.
Okay. How do you like it so far? You have been here since September, right?
Since September, yeah, and I really like it. I found a lot of very nice, good friends, like one of them next to me.
Thank you so much. Thank you so much for saying that.
And I'm really happy here. Yeah,
You're happy with your decision, let's say. So far, so good.
Yeah. Everything is great. I love the university.
Yeah. Before the decision was made, there was a procedure. So, could you please go back to the procedure? Why you choose Poland?
I chose Poland because I'm half of the Polish. I have Polish roots.
So back to home, back to the roots,
back
right?
to home.
Back to home, right?
In some way, yeah. I speak a bit of Polish. Yeah, and I really like the country, the culture. It's very similar to my culture. Yeah. Very understandable. The sense of mind, the language. So I used to before maybe 5 years ago. I've been here. And I was I really like the country, really.
Okay, so. That's so nice. It's like a hidden gem, you know. Before you go, you're a little, but by the time you reach Poland, especially the Silesia area here in Katowice, you're like, okay, that was a good one. That was a good choice.
Yeah.
But how did you choose? You said, okay, Poland, but why did you choose University of Economics in Katowice? It was like a special program that you liked? Mm-hmm. There was a reason that you came, or just like, okay, let's go there.
Mm-hmm. I really like the program it as well. But also I've been here before in Katowice. I knew that there are some places as Katowice, some universities when I decided to go to study in Poland, and I think that our university was one of the highest position in my list to apply.
Perfect.
So it was I really liked that it's in English. And it's for me, seems like a very good opportunity to go.
It was like a conscious move. It wasn't just like random one.
No. I had a list. I tried to research. It was a lot of work, actually.
But you're happy with your decision, and that's all it matters. So today I would like to talk about something not that easy. We're going to talk about something sensitive, like healthcare here in Poland, like health issues regarding everyone, because we are human after all. We may be foreign students, we may be young, but we're human after all, right?
Yeah, sure.
Sometimes things go south, so we gotta be prepared.
Mm-hmm.
So first of all, I would like to ask you, what is your general impression? I mean, did you regarding public healthcare system here in Poland as a foreign student, it's not European, because the things for a European such as me, it's a bit of different. I would say completely different, actually, because you have to follow some different procedure regarding insurances, regarding whatever. So, as I know, in the past you had some issues. So, could you please recall back to those days?
Sure. First of all, I would like to say that I would highly recommend it to have insurance before you have some trouble with your health, because you would have a lot of difficulties if you would have some accident or some health issues and you don't have insurance. I would highly recommend you to think about this in advance. So, and actually I have a kind of special situation because I have a Polish card, so I've got a visa very easy without anything, just a card mostly, and just fill the form, put my names and stuff. But in general, if you're a non-European citizen, and you don't have Polish card and stuff, basically you need to buy insurance before you come to country, and it's very logical. So in the country, like we have a national insurance of health, which is cost like I think like 15.3 or 15.4 zlotych. It's very cheap for a year.
For a year, yearly.
Yeah, for a year.
It's
yeah.
like
it's like nothing.
Kinda. I don't want to say, it's weird to not get it if it's like that cheap,
Yeah. So because of, basically health like service in Poland is for free.
It's for free, yeah. Public healthcare is for free, so available for everyone.
Yeah, it's kind of, I think...
It's a little tricky.
Stuff.
There is like some bureaucracy, as always, in every country. So I think for yours it was a little different, the situation. So you mentioned that everyone should have it before they got something, Get your insurance before you have an issue, which makes sense. Did you, though? Did you had it before?
No, I didn't, because
you had the card.
Yeah, I had a card and I've got the insurance, I think, after the couple of 3 weeks when I came.
Weeks.
Like it was like I went to the service. Like you need to go to the. I've got the
internet appointment.
No. It was a national. I've got a general national insurance.
Oh, okay. Sorry. Yeah.
And I was like, it was like you came to the office, you fill the form, you put some your like information, your ID,
your data,
your parcel and stuff, and you then got the insurance and you can go to the hospital.
Quite simply the procedure,
yeah,
right?
Very simple, yeah. And you what you can do next if you have some trouble, you have to be registered in some of the hospital nearby your home.
Okay.
I think you can be registered anywhere, but it's easier to.
Yeah, of course.
Because I was like, I will tell it later. Like I wanted to find a doctor who speak English, and I try to search around around Katowice. And if you go to far away from your home, because they ask you like about your address, and if it's far away from your address when you leave, they could say, why you come here? Like you
really?
have you have some nearby you. But I think like if you want, you can do this.
Yeah. I was here. It's an emergency.
Yeah.
They're humans after all. They understand the situation.
Yeah. So you have to find some hospital which you want like to register it. You also go there. Like you already have a parcel, you already have an insurance, and you fill some form. Very easy.
It's quite easy, the procedure.
Yeah, and then you can do some appointment for the doctor.
Okay, but let's go back to your issue. Well, as I know, you had some minor issue, health issue, but you needed to see someone.
Yeah.
So, what was your step as a foreigner student here in University of Economics in Katowice, who doesn't speak that much Polish? You said you speak a little Polish.
It could be a problem.
You speak Polish, but in a good level, but not in a medical, because you have to be extremely precise.
Yeah.
So please, Ella, give us some tutorials. Like, I'm a foreigner student who I have a headache, let's say, or a little more serious issue. What should I do? What did you do in your occasion? Tell us your story.
So, if you have some not that serious issue, you can try to go first to the pharmacy, for example, and buy some pills. You can buy something without any recipe.
Oh, you don't need a prescription
for some of them,
for the simple things.
And sometimes people who work in the pharmacy could give you very good advices.
Yeah, because I have a headache. What should I get?
So it would be quicker, because if you have some trouble issue, you need to do appointment when you can get the doctor immediately.
Really?
You need to
How do you do it then?
Like you have to make appointment.
Okay.
If you already registered it or on the
system.
On the hospital, you need the woman could tell you you can come on Thursday at 11:15.
Okay. So, what did you do in your issue? Besides the pharmacy thing, okay.
Yeah,
it's kind of normal in every country. If I have a minor headache, a stomachache, or something like that, okay, I'll go to the pharmacy. But let's say you don't have also PESEL, because a lot of foreigners who came here, PESEL.
No, they have to get a PESEL. It's
mandatory.
Yeah.
I never did, because I'm European.
Maybe.
So for our international, global students who are like from different continents and who are not EU citizens. And they're gonna get a PESEL number by the time they arrive here, right?
Yeah.
It's
I
mandatory.
think it's the first thing I did.
Okay, so okay, you have your PESEL number, you have everything, and you're let's say in the university area, and you don't speak Polish. You are lucky because you speak a little bit.
Trouble.
So what would you suggest a student to do?
First of all, we have uni buddies.
Yeah.
We have amazing welcome point.
I mean, you came to welcome point, right?
Yeah,
right.
you can go to the welcome point. You can ask whatever you wanna to ask. You need to get some there are a lot of very nice, helpful people.
Yeah,
you should be you can be sure that you will get some help. And if you're really going to visit some doctor, I would highly recommend you to ask some Polish student to go with you if you don't speak like any Polish.
Yeah.
Because they can. It's even in the very beginning when you need to fill the form, it's in Polish.
And also it's really important because, as I told you before, we're talking about health issues, which is really. You have to be precise. For example, you cannot be like, You have to be extremely precise. So having a friend or a uni buddy or even call us, like we did with Carolina last time, it was a Spanish girl, she was calling, and we make the translation over the phone, you know. And also your experience, because I remember the issue, Carolina was telling you cannot go to the hospital, you have to go there first. And I was listening also, I'm like, okay, taking notes, you know, because even if I'm European citizen, but still, I have to follow the same procedure, and for me it's strange also. But in general, would you say like it's an easy procedure, right? It's not something. We're talking about issues that are not needing emergency treatment.
No,
like if you break your hand or if you need immediately treatment, you just go to the hospital, and it's gonna be okay. But we're talking about you have a back pain. You have to follow a specific procedure. You can come to welcome point, contact your uni buddy. As a foreign student, you're gonna have one. Then you make those appointments. We help you fill the forms. We help you do the situation, and then there is an appointment, and that's how you go to the doctor, right? I get that correctly, right?
Yeah. You have to do insurance. Some documents, your ID and stuff, PESEL, and then you register it in particular hospital, and then you can go to the doctor. But it's it's not private. It's public. Public, right?
But I know you have some like private insurance, or you have some friends who did something like that. So could you please tell us a little bit about more? What I did a private one before I even came to Poland. As you said, it's a smart thing to do, but. Could you please tell us more? You did it here in Poland, right?
Yeah, you actually in Poland there are a lot of
companies. And international ones.
International ones, some private clinics, which would be very nice, and you need to buy a specific insurance to take some.
And your specific needs. There's a lot of problems. So.
And it depends, because it could cost pretty much
you gotta be careful what you choose. Yeah. It's a great to be safe, but also keep in mind that it's money. So everyone has to adjust to that.
So you can research if you don't really trust the public a public service.
I mean, I had an experience here in a hospital. It was like an emergency, so the public healthcare here, I think it's quite good, in my experience, because everyone has a different experience. I was with some friends, and our friend suddenly got dizzy and passed out. It was like early afternoon. We were in Warsaw. We were having fun, walking around, and he was like, I don't feel very well. And I'm like, okay, maybe from walking, we had a need, you know, and he suddenly fainted. And we're like, okay, you go into panic mode. So we went to a hospital, but the thing is, we were European citizens. So we had the European healthcare card, which is like, in order to let everyone know, it's like, if you're a European citizen, you apply for this card, it's free of charge, and you have access to every public care center in the whole European Union zone. So we went to the hospital, none of us was speaking any Polish. So it was a Spanish, a Greek, and a French, like a joke, you know. So we went there and we just present ourselves like
hands,
like Google Translate, please help him, you know. So can't complain. The public healthcare system. My experience was nice. So
so you find somebody who speaks English, or just they try to
like
understand?
Google Translate. Our friend was like passed out, so they made the assumptions.
Yeah.
They are willing to help. That's all you can ask
Yeah.
for. So in general, in your opinion, in your experience, do you have a good impression about public healthcare system here in Poland?
People really try to help. Like they try to understand you as much as possible.
Which is really important.
Yeah.
That's all you can ask
but
at first.
to be fully understandable, to make this process, like even if it's not emergency, like you need to help now and understand it, and explain in any way. If you need to some another kind of help, of course it's easier.
Call your uni buddy or call Welcome Point or someone.
Or
gonna
find
be,
some.
Or a friend. You have a Polish friend. You're gonna meet some Polish friends here, so they're gonna be willing to help. So
But it's also possible to find some doctor who speak English.
Yeah, of course, yeah.
So it's would be easier.
Anja, at this point, I would like to thank you so much for being here, for making the time to come here. Thank you so much.
Thank you so much.
It was lovely having you. Thank you so much for listening. See you in the next episode.